Dr. David, thanks a lot for joining the conversation with ETHealthworld, the Economic Times Group. So, to begin with, I would like to ask what motivated you, or what was the decision like which made you to there's this transition from clinical practice to a leadership role at Mount Sinai. So, how was that?
Well, it was a very gradual transition. When I was a resident, I became a chief resident and started doing some organization and teaching. And then after I became academic faculty, it was clear that the goal was to be chairman of a department. And after I was chairman of a department for 9 years, I was asked to be hospital president. And so it's really just a matter of seeing whether you enjoy that. And I found that I enjoyed administration because I could I could develop programs in new ways. And I found that that gave me great satisfaction.
So, how do you balance the administrative duties with maintaining a connection to patient care and clinical practice? And which is more challenging?
Which is more challenging?
Yeah.
Well, I go to the operating room most Fridays and I provide anesthesia for heart procedures and usually work with the chairman of cardiac surgery. We often do a mitral valve repair. And I usually work with a resident in anesthesia that's 3 years out of medical school and still very junior, and they're not so proficient yet. They can't do the echocardiography, for example. And so that is a lot of fun for me. I call it my mental health day because it takes me away from the administrative work. And obviously administrative work is largely about creating new programs, but also solving problems. And some of them are very challenging. So I would say that balance between the two is very helpful. It's helpful to be an administrator who is in clinical practice, and it's helpful to do the clinical practice to remember why you went into medicine in the first place.
Okay. Everybody is talking about AI, but often seen as hype in healthcare. So, by embracing AI-driven solution, how can hospitals strengthen their financial performance and reduce clinician burnout? Like, what is the reality, if you can tell us?
Well, there are really many realities, and there's no question that AI will infiltrate every business there is, and healthcare is a business after all.
Yeah.
So, for example, to help bring the right team to the right patient at the right time, and that's very helpful in terms of outcomes. In the US, we also saw an economic benefit in certain circumstances because we would diagnose and treat conditions like malnutrition in the U.S. system will get paid more for the hospitalization if we appropriately make certain diagnoses. But I'd say the bigger use of AI will be in areas like radiology and other areas of imaging, such as the analysis of pathology slides, because one of the things that AI is probably going to surpass humans at in the not too distant future is the ability to make diagnoses of patterns based off of images. I think the bigger challenge will be how does that interact with the physicians and the nurses? It probably interacts with them by making them more efficient. So one radiologist might do 3 or 4 times as many studies in a day because if the AI helps them by making a presumptive diagnosis, writing out the description, and then the radiologist can review it and indicate whether they agree or not. That way you extend the ability of the human. The other thing that has happened is electronic records are very pervasive in the US, and they generate a tremendous burden on doctors, nurses, other healthcare professionals because the amount of time it takes to do the documentation is excessive. We actually estimate that our nurses spend over 50% of their time documenting. Using AI, specifically having AI listen to discussions with patients, writing based upon that ambient listening a note, and doing the initial work in terms of presumptive diagnosis, again, that can extend the ability of a physician or an advanced practice nurse to be able to do their work more effectively and efficiently, and perhaps also with less burnout because they spend less time writing up what they just did and more time interacting face-to-face with the patient rather than there's the patient, but I'm staring at a computer instead.
So in Indian healthcare system, it's very complex. There is multi-speciality hospitals also, there is super speciality hospitals, and there are government setups as well. And the affordable healthcare, is still not, like, it's not, the healthcare is not reaching to the last mile. How do you think AI or the technology can help a scenario like Indian scenario in the Indian healthcare system?
Well, one of the things that we're working on right now is we use a partner, a company that produces AI in a chatbot format. And so we use that right now, and it's live, and it asks the patient questions. And depending upon their answers, it helps decide, should they have a telehealth appointment, should they go to an emergency room, or are these like minor symptoms which they could follow up with their normal doctor on a regular basis. So using tools like that can extend the capacity of people in a developing nation to have interactions that find the right treatment for them. Because in most cases, it might be simple medication that may help with a particular problem, or sometimes just plain reassurance. And then you don't have overcrowded emergency rooms and the expense of people going and having a minor diagnosis, and then they spent money to go to that emergency room. Much better if we can use an AI chatbot to do presumptive diagnosis and properly triage the patient.
I want to talk about the partnership with Ramaya Memorial Hospital. What kind of things you're expecting out of this collaboration, and how it's going to, what kind of technology transfers which is going to happen? What kind of skill building initiatives is going to happen with this, partnership?
Well, I think the partnership will have multiple aspects. In certain cases, we can assist in sharing some best practices that have been developed in the U.S. with physicians who would not normally be able to afford to come and train in the U.S. And so we can extend and share knowledge. And also it works in the other direction too, because you have tremendous diversity here. You have very large population. And so, for example, we have a laboratory, clinical laboratory, that develops new tests. Mount Sinai actually does more tropical disease testing than the Center for Disease Control in Atlanta at this time. And if we worked with an organization like Ramaya in a population that has those types of diseases, we could perhaps improve the care, the diagnostic care, develop new tests together. Additionally, there's a tremendous amount of tissue that's donated here. People donate for medical research, and those tissue banks can be very helpful to groups like pathologists that study and help create new therapies for disease. So I think that those are just a few examples of ways that we'll work together, but also I think I would end by saying that having Bangalore as Bengaluru as the center of technology in India, that as we talk about things like AI and development of new tools, that I imagine we would be able to work with Ramaya and local partners in Bengaluru to help develop our technology more effectively.
And how do you view the medical tourism in India? How is the scenario right now? How it can get better?
I'm not an expert, but I believe that one of the ways that it can get better is with the low cost structure, as you already mentioned, evolving the health system so that there's more in the way of electronic health records, the safety features that are built into the workflows. But I'd say take what you have and make it even better, even safer.
Okay. So you have also touched upon the biggest challenges, but being specific, like being a president of Mount Sinai Hospital, the challenges you have seen, and what makes you motivate and inspire your role as a healthcare leader, if we can answer.
Well, I'd like to think of it as we're on a journey to create the safest hospital anywhere. And maybe it's a little bit of a competitive spirit too, but how can we take the knowledge that we have with the top medical school, with a very large hospital system with 8 hospitals in it, and get to the next level? I think the answer is to focus on using technology and take the natural scientific interest and motivation of people who went into medicine to make life better for our patients and to make it safer, more effective, more economical, and to improve access to care for all, and do it in a way that's not biased and provides more access to people of all socioeconomic status.
Thanks a lot, Dr. David, for your time. Thank you so
My
much.
pleasure as well.